So let's talk about how to pass clinical in nursing school. Hey, this is Thomas from Nurse Money Talk, where I help nursing students become nurses and nurses excel in their nurse career and nurse life. And let's talk about clinicals in nursing school for a second. The way I look at nursing school is I look at it as two parts. So one, you have your actual clinical, and two, you have the lectures. The way I see it is, this is overly generalizing it, but you can kind of look at it this way. The lectures, so your actual classroom time, they are teaching you how to pass the NCLEX. The actual clinicals you have, assuming they're good clinicals with good clinical spots and you have a good preceptor with you, are going to teach you like vital hands-on skills that you're actually going to need in your career. Now, obviously, you need both of them. They both complement each other because it's not just about the skills and the procedures and whatnot. There's obviously the knowledge, the evidence-based practice and whatnot that you need to learn the evidence-based knowledge and whatnot that you need to learn from the actual lectures themselves. But the lectures, different video, different conversation. As for the clinicals can be really good if you're fortunate. So to me, there are two things that will make for a good clinical. One, hopefully you're in a good facility with good floor, good nurse and whatnot that actually cares about teaching. So that's the facility standpoint. And then you actually have the other standpoint that to me can actually be more important than the first one, the facility part that I mentioned, and that's you. You have to come in ready to go prepared and whatnot to make things happen because the first thing you got to know is that you're there to learn, and that's just you're there to actually learn. You're not there to goof off. You're not there to try to catch up on past assignments and anything else. You're there to learn and ideally get the clinical experience. With that said, the second part of that is that your clinical experience is your responsibility. It is not, obviously your school plays a part, and hopefully I already mentioned the facilities part of it, but you got to remember it is your responsibility. Nobody there is going to care more about your education, more about you passing the exams or, passing your assignments or whatnot than you will. And not to mention, if you look at those staff members there, a lot of them, I'm not saying right or wrong, I'm just saying this is the reality of the situation. So for a lot of them, they're probably understaffed, have way too many patients given to them. So they're probably upset about that. You don't typically, they probably didn't choose to have a nursing student follow them. They were just, you just showed up and well, here you go. And so they're so busy doing X, Y, and Z that they are not going to chase you down to do X, Y, and Z. They're not going to chase you down to do an IV. They're not going to chase you down to do a Foley insertion. They're just, for the most part, they're just not. There's not enough time in the day for them to go follow, to go try to hunt you down. There's one exception to that, and I'll get to that here a little bit later. And so you have to show initiative. You have to be aware of oh wait, there's somebody that needs an IV in in bed 20. Oh, okay. So then I need, this nurse is about to get an IV here. This patient's about to go do X, Y, and Z at this time. This is happening. So you have to be cognizant of what's going on around you. Before I move on to the third point, the thing that I was going to mention is that typically staff doesn't typically look around for nursing students unless it's something that they don't really want to do. That's been from my experience anyway. And then that's when you'll probably see, like, even when I was in clinicals for like a nursing school, I mean, it was like, and I was like all over I was trying to be helpful. I was trying to do this because I wanted as much exposure and opportunities as possible. And I did notice that the staff, especially the floor staff, they went looking around for students when it was something that they didn't actually want to do. Yeah, I mean, right or wrong, that's not the point. I'm just kind of giving you that kind of a heads up. The next thing I want to bring up is to make life easier for the hospital staff. And that goes with the other things that I've mentioned already. And the reason why is, like, when you're making life easier, when you are making life easier for the hospital staff, when you're being proactive, you're helping to, I don't know, give bed baths, turn patients, whatever, maybe help the techs a little bit here and there. I mean, just kind of like stuff like that. Like, I know that, and obviously you're there as a student and you're there to learn, but at the same time, like, I mean, I don't know, I guess read the room a little bit as well. I mean, when you make life easier for the hospital staff, I found it interesting that is when I've seen staff actually go hunt down nursing students for the cool procedures. I remember there was one clinical that I was at. I was working hard. I was, kind of like all over the place running. I did actually learn a fair bit too. The nurse I was following originally seemed kind of standoffish. And I was just like, well, I'll do what I can, I'll kind of power through it. So I was working hard, and then I noticed, like, after I've been there for a couple of hours, that she started looking for me for like the cool stuff, for like IV starts, like Foley starts. I mean, the stuff that, like, a lot of things and skills, if you will, that a lot of my classmates hadn't really even gotten a chance to do yet. And that was because I was being proactive. I was trying to be helpful, make life easier for her. And then, interesting enough, she, I got to do, some cool things that, that a lot of students, just don't get a chance to. I mean, starting IVs and some of those other quote unquote skills from my experience with clinicals really come few and far between unless you're very lucky. On top of making life easier for the hospital staff, you need to really make life easier for you. And that goes into my next point, which is make sure you're getting a good night's sleep. It sucks going to lectures, going to clinicals, trying to study, trying to do anything where that requires like very high mental acuity and be tired. Because at that point, and sleepy, at that point, I'm more focused on trying to stay awake than it is paying attention to what you're saying. Not to mention, I think in general, just from best practices, I mean, if you look at a tired nurse, that increases the chances of patient errors happening. And so I think it's really good to start getting into that mentality. The next thing is to prep the night before. Clinicals can be very stressful, especially depending on where you're at. And so just make sure, for example, that You have whatever you need laid out for in the morning, whether that be scrubs, you already know what you're gonna have for breakfast. Make sure everything's packed, your books, just all of those things. Just make sure those are all ready, set to go. Make sure your assignments are done. Not only make sure that your assignments and your care plans, care plans, make sure those are done, and then make sure you actually pack it with you, print it out, or bring it with you if that's what you need to do. All of those things will help make things easier. Just like the little things, especially like if it's your first day going to that clinical and you've never been to that, maybe you've never been to that hospital, maybe you've never been to that floor or that department or all the above, then make sure you leave with plenty of time so that you don't start running late. It makes things more difficult for you. Next one is make sure you're following orders. Nursing school is one thing, clinical side is something completely different. That is your preceptor's patient, that is your preceptor's responsibility. So you need to make sure you're following directions. Not following directions could be grounds for potentially being dismissed from that clinical spot or from you being sent home or whatever the case is. If you're having a situation where you think that you're following a nurse who's doing something that's not appropriate or potentially dangerous, then that is something that you should look at addressing with your whoever your clinical instructor is. Know what your hospital's protocol chain of command is, and make sure you follow that. Next one is if you're given an opportunity to look at the chart of the patient that you are assigned to and taking care of, try to, get acclimated to the patient. Know, this is the patient's this is the patient's issues, this is what's going on. All of that stuff. Make sure you're well versed, and you'll probably already have care plans and assignments that are going to have you do that anyway. But this is just to emphasize that it's really good to be well versed in the patient you're taking care of, because one, as a nurse, you're going to have to do that anyway. The clinicals, I look at clinicals as preparing me for real life, and so real life. You need to know your patient. And so you're preparing you for real life, and then it'll also make you look good in front of your instructor. Next one is make sure you're participating in daily briefings. So these would be briefings that you're potentially having with your clinical instructors. You might have your meetings at the end or at the beginning or both, where you're asking questions and whatnot, going over what's happening, maybe going over assignments. Try to participate in that. So one thing I would recommend to a nursing student that's going to clinicals is know who your team is. For example, obviously know who your clinical instructor is. Know who the nurse you're following is, but your preceptor. Not just that, know who else is working on that floor. And that's important because for example, you could have a registered dietitian there. You could have a respiratory therapist, a physical therapist. You could have the techs that are working there. So know who these people are. And when you get a chance, if there's a downtime and you can pick their brains, ask them questions, that is a good opportunity to it. Because the thing about healthcare is that it's a bunch of specialties. And so while the nurse is trained to kind of be whether you want to call it the Swiss Army knife of jack of all trades of everything that's going on the floor, there's something to be said about talking to the specialists in their unique areas where that is all they do. Registered dietitian, dietary, that's their focus. Nutrition, that is their focus. Physical therapist, an occupational therapist, if you get a chance to talk to a speech pathologist, depending on where you're at, a respiratory therapist, if you're in the ICU and you have a patient that's on a vent, if you get a chance, pick their brains about the ventilator. Those are opportunities to really just kind of get yourself familiar with those things. The next one is interact with your patients. Try to talk to them. The thing about some patients is that they've been, they might have been in a hospital for so long, depending on, how long they've been there. Have they been having family members or not? Some of them, like just a few minutes you can take to ask them, ask them questions, talk to them. Hey, what's going on? So on and so forth. I mean, that would mean a lot to them. And two, I think you can learn a lot from some patients, especially like, if you get into a conversation about, maybe their symptoms that they were having or just kind of like something like that. And so you can kind of like get an example, like this particular disorder or illness, it manifested these symptoms on this patient or something like that. I mean, so there's always, I think, opportunities for learning. Next one is do not be a complainer. Please, for heaven's sake, do not be a complainer. Do not walk into that unit complaining. I mean, it just doesn't go well. At that point, you already have the nursing staff. If they don't say anything to you, I'm sure they're already looking at you and probably, telling some other nurses like, really, they're complaining. Do not walk into the floor where you have nurses who are probably, or even the ICU or whatever, where you have nurses who are probably stressed out because they're overworked, understaffed, or whatnot, and then try to make them. I mean, just remember, you're a visitor. I look at it as more like, when I looked at it as like I'm a visitor in their home. I want to be respectful of that. And so I think it goes a long way, and definitely complaining. I mean, that's just not good. The next one is just ask questions. If there's something you don't understand, or if you get an opportunity, ask questions, pick your nurse's brain on some things. I think people underestimate, the benefits of asking a question. You'll get to learn, you get some clarifications of things you don't understand. And two, and I was reading something a while back ago that people like you more when you ask them questions, and the way I kind of understood it is, honestly, just to be straight to the point, people like hearing themselves talk. It makes them look, it makes them feel good that, oh wait, like I'm the expert and you're asking for my thoughts on X, Y, and Z. So, but with all seriousness, I really did actually see that. So I think you really should be asking some good questions. Like, if nothing else, make a list of some good questions that you're going to be intentional about asking your preceptor. But I think a good question really goes a long way. Just make sure the thing with that though is just make sure you're picking good times to ask, to ask those questions as well. So obviously if they're like super busy, might not be the best time. If there's some downtime or whatever, and it's kind of a chill moment going on, then of course that would be some good times to ask questions. I hope you found this video helpful. And especially I hope that, if you're in clinicals or you're about to be in clinicals, that you can take some pieces of advice that I mentioned and kind of apply it to what's going on. So a couple other things, if there's any questions you have, let me know in the comment sections below. If you found this helpful, please don't forget to hit that thumbs up button and that subscribe button, and so you don't miss any of our next videos. Thank you so much for watching this, and don't forget to share this with your peers if you think that they'll find this helpful, and I'll catch you very soon in that next video.